Thanks very much for the introduction. Appreciate that. So, like Quentin said, I'm a general cardiologist. I see patients in Greenville and Easley. I'm part of Carolina Cardiology, which is a group within the institution formerly known as GHS, now Prisma. If anybody's eyes are hurting, I apologize. I did not choose our new color scheme. So, so Quentin asked me to talk to you guys today because it's Heart Month, and just a reminder that heart disease is very prevalent and important to think about the signs and symptoms of heart attack and heart disease, how to recognize that, and then we'll talk a little bit about how to prevent heart disease or prevent another episode of heart disease. So just a reminder that on balance, heart disease is the most likely thing to kill Americans these days. It's the most common cause of death. It's responsible for almost 400,000 deaths a year, which is a lot. And the important thing to remember is that the American Heart Association says that we could be preventing about 90% of these heart attacks just by changing our lifestyle, changing the things that we do, we eat, how we live. So we'll talk a little bit about that today too. So what is a heart attack? A heart attack is when some of your heart muscle is not getting enough oxygen through blood flow and dies. Now, the most common cause of that is because of cholesterol plaque that's built up in those arteries that blocks the artery. And at some point that becomes too much. It blocks the artery completely. Your heart muscle doesn't get the blood flow it needs to stay alive, and your heart tissue dies. That causes pain. So, heart attack warning signs. I think everybody knows from the movies that when you have a heart attack, you clutch your chest and you groan and you fall over. So that's what the movies would have you believe happens every time, but that's not. Now the classic symptoms of a heart attack are chest pain that tends to be pressure-like or tightness. It may go to your arm, to your neck. Classically, it occurs when you're exerting yourself, gets better when you rest, but sometimes it can happen when you're just sitting down. But that's not always what happens. Women are more likely to have atypical symptoms. That may just be a profound feeling of fatigue. It may be shortness of breath. It might be belly pain or nausea or vomiting. It might be back pain. The things that we worry about are symptoms that come on immediately or severe, don't go away. That's always a reason to go get checked out immediately. We know that a lot of the heart damage occurs in the first few hours of a heart attack. Our mantra in the group is time is muscle. So the quicker you can get to medical care and get that blockage resolved or otherwise treated, the more likely you are to retain good heart function and not have a lot of damage. So don't write off new symptoms that you've never had before. Don't write off symptoms that are getting worse and you don't know why. So what to do if you think you're having a heart attack? Number one, the first thing is get help. Like I mentioned, we really can give you the most help and the most benefit the earlier you get to us to evaluate you. Call 911 if you have somebody with you. Ask them to help you. Tell them what's going on. If you're waiting around and you have time and it's available, take an aspirin. If you're not already taking it, chew it so it gets in your bloodstream faster. That aspirin helps prevent blood clots and can actually restore some of the blood flow in the short term while we're getting you to where you need to be. And if you have a history of heart problems and you have nitroglycerin and your doctor said it's safe for you to take that medicine, take one of those while you're waiting as well. But really the most important thing is get to the hospital, get evaluated. Don't sit and suffer all day and then decide at 4 p.m. This is not getting better. Better go in and get looked at. So I think the more important question might be, well, how do I avoid this? So the American Heart Association tells us 90% of these heart attacks can be prevented. Well, how do we do that, right? If this is so common, why is it so common, and how do we make it less common? They put together something called Life's Simple 7. So these are 7 behaviors and activities that you can do to reduce your rate of heart attack. And that statistic that I mentioned, about 90% of preventable attacks, is if everyone followed these seven behaviors, that we would be able to do that. The sad truth is something like 1% of the population actually hits all 7 of these good things. So I think we've got a lot of room for improvement. So we'll talk about these kind of one at a time. So the first thing is stop smoking. So smoking greatly increases your risk of heart disease and increases your risk of heart attack. It's probably the biggest one thing you can do to reduce your risk. So if you have to pick one, if you're a smoker, that's the biggest thing you can do is quit. Those changes start happening pretty soon after you quit, even as soon as 20 minutes. Your blood pressure lowers, your heart rate lowers, and that function continues to improve. And 5 years after quitting, we think your risk of stroke is similar to that as if you never smoked. Now, heart disease takes a little bit longer for that risk to go down, but you do derive benefit even if you smoke for 50 years and you say, well, it's too late for me. Not true. We see beneficial things happen even in the short term. So how do you quit? Decide you're going to quit. That's the first most crucial step. If you don't decide that you need to, you're not going to be successful. So set a date. Decide when that's going to be. Decide whether you're going to do it on your own or you need help. I'd highly encourage you to get help. The statistics show us that about twice as many people quit if they see a doctor and use a medication such as nicotine replacement or another medication to reduce your cravings. Get ready with a plan. Smoking is sometimes as much about the act of it as the nicotine, and so coming up with something to do with your time and your hands when you have those urges is important. And then do it. Quit. And if you fail, don't be discouraged. This is one of the hardest things we ask people to do. Go back and get help again from your doctor and keep trying. It's a worthy goal, and it's as I said, the biggest thing you can do to reduce your risk of a heart attack. Number 2 is eat better. So, I tell my patients there's no good news when it comes to preventing heart disease with regards to diet if you like to eat. I like to eat. I enjoy food. And the science tells us that the best way not to have a heart attack is to eat plants and only plants. That's a far cry from the average American diet. It's an especially far cry from the average South Carolinian or Tennessean's diet. I respect that. And as my dad told me when I was talking to him about this, he said, well, Dave, I'd love to live another 5 years than I would otherwise, but if I can't eat bacon, then what would be the point? And so I say, I'm not sure I want to live in a world without bacon either, but it's got to be every now and then, not what you eat every day for breakfast. And if you're not ready to make that big change to eating a plant-based diet, you can make small changes and still improve and reduce your risk. There's some great studies where they've looked at, and it's kind of a sliding scale. The more calories you get from vegetables and the less animal products you can eat, the lower your risk is. So it's not an all or nothing thing. You can make small changes and have good success. My family and I are in the process of trying to eat less meat and more vegetables, and we're eating vegetarian about 3-4 days a week. When we eat meat, we try to eat fish. I think that's probably the best for you with regards to meat. I lost some weight when I did that without even trying. That's a side benefit, is you just tend to eat more healthier foods and feel fuller. So you can make some small changes and make big improvements in your risk. Learn how to read packages. I would say if you can avoid packages that have nutritional information, that's the best thing. Buy real food, cook it for yourself at home, then you know what's in it. But if you're going to eat food from packages, know how to read those. Know how to look for saturated fat. That's the kind of fat that tends to turn into plaque in our body, and cholesterol. Know how much sodium is healthy to eat. I tell my patients to shoot for 3,000 milligrams a day or less, maybe even stricter than that if you have high blood pressure that's hard to control. And just pay attention. Pay attention to what you're putting in your body, because it does make a big difference. Number 3 is get active. This is something I think we all struggle with. So we know that exercise reduces your risk for heart attack. I tell my patients in clinic, I almost kind of feel like a used car salesman when I talk about exercise, because of all the different benefits it gives you. It decreases your blood pressure. It increases your good cholesterol and lowers your bad cholesterol. Makes you sleep better. Makes you feel better. Makes you be less likely to be depressed. There's a lot of great benefits. And the American Heart Association says 150 minutes a week of moderate intensity exercise. Now that means anything that gets your heart rate up and keeps it up there. For most people that includes a brisk walk. So you can think about that 30 minutes 5 times a week. There's been some other studies that suggest 30 minutes 3 to 4 times a week is where you get kind of most of your benefits. So even if you're getting 30 minutes 3 times a week, that's a worthy goal and something that is generally pretty achievable for most people. There's also, sorry about that, some evidence that lifting some light weights, getting some muscle strengthening activities also gets you additional heart benefits. And another big benefit to strength training like that is just to help prevent frailty, prevent falls. There's good evidence that people that do those sorts of weightlifting and that sort of stuff reduces your risk for falls, hip fractures, that sort of thing. But get active. Be active and get some exercise. So if you're overweight, another thing you can do is lose weight. This is one of the simplest equations in all of medicine. So weight loss is less calories in than you have calories out. It's a simple equation, but there's a whole lot of factors that go into that equation. And the nitty-gritty is where it gets complicated. But if you're overweight, losing weight can also reduce your risk for heart disease. So another way to think about it is your body mass index. That's your weight in relation to your height. 200 pounds may not be overweight for somebody my height, but if you're 4'11", that's overweight. And the BMI is the way to figure that out. And that's an easy calculation to do. Number 5, manage your blood pressure. So increased blood pressure increases your risk for heart disease. It's a well-established relationship. Something like 75% of people over 50 now have high blood pressure. The average number of medicines they're on is 3. So if you're on less than 3 blood pressure medicines in this room, you're doing better than average. And that's kind of a sobering thing. And I think that's in large part because all the foods that you see that are prepackaged and pre-processed these days are just packaged with a whole lot of sodium. So we eat way more sodium than we ought to, way more than our bodies want us to. So we really ought to be shooting for a number that looks like 120 on the top number and 80 on the bottom. Our thresholds to treat high blood pressure are getting stricter and stricter because the evidence just tells us that the more we control that blood pressure, the lower your risk for heart disease, for stroke. So currently our goals are less than 130 on the top number or less than 85 on the bottom. And if you're consistently above that, typically we will treat that with medications. One of the best ways to change your blood pressure for the good on your own without medicines is avoiding salt, avoiding sodium. Exercise and weight loss can both help that as well. And we as providers can help you track that and manage that and improve that. Number 6 would be control your cholesterol. So I mentioned that animal-based products just give you cholesterol, which helps build those cholesterol plaques in your arteries, and that's what causes heart attack. Good cholesterol reduces that risk. Bad cholesterol increases that risk of heart attack. So knowing the things to eat that are good cholesterol that help raise your good cholesterol is important. Nuts are high in omega-3 fatty acids, which help you build good cholesterol. Fish as well. It's actually the fattier fish, the oilier fish that have more of those good fats. So things like salmon, tuna, mackerel, sardines, those are good for you, and as far as animals go. And avocados and some other fruits have those good fats as well. In general, anything that's fried is going to be high in saturated fat. We want you to avoid those. And as much as you can avoid intake of cholesterol itself. Cholesterol does not come from plants. No vegetables or fruits have any cholesterol in them. So if you're eating a plant, you don't have to worry about it. Cholesterol only comes from animals and animal products. And know what your goal levels are. That's different for everybody. If you've had a heart attack or a stroke, that means you've already had disease occur from these cholesterol buildups. In that setting, we control your cholesterol a little stricter than if you just are at risk for those things. So knowing what your goals should be and talking to your doctor about that can help. The last one is reduced blood sugar. So diabetes is another thing that's become more and more common. Those processed foods that are processed with a lot of sodium tend to also be processed with extra high fructose corn syrup. That thing makes things taste better and it makes them stable on the shelf forever, but it does not do you any favors with regards to developing high blood pressure and diabetes. So controlling your blood sugar is another big part of being healthy and preventing heart disease. We think normal is in the realm of lower than 100 if you're fasting or not eating anything. If you're above 100, you're at risk. If you're above 125, you have diabetes. So having that checked is important, and watching those carbohydrates and things like high fructose corn syrup can reduce your risk. So, sorry that got cut off a little bit. That says, what if I've already had a heart attack? I want to emphasize that doesn't mean that it's over, doesn't mean that you can just give up and stop trying to be healthy because you've missed the boat. All of these things that we talked about can make a big difference in whether you have a recurrent event or whether you recover from your first one. You can still greatly decrease your risk for another heart attack. There's 5 things that the American Heart Association says you should do. Number 1, take your medicines that we send you home from the hospital on. All of those are there for very good reasons, and if you're concerned about them or you have side effects, rather than just stopping them, go talk to your doctor. A lot of times we can come up with alternatives that don't give you those side effects and work for you. Number 2 is go see your doctor. Make sure that you actually go back and follow up, because there's a lot we can do after the fact to alter your trajectory. Go to cardiac rehab. Cardiac rehab is a supervised exercise program that gets you back exercising and moving safely after you've had a heart event. People that do that tend to live longer, feel better, and are less likely to have to go back to the hospital. I think that's 3 great things, and so I always encourage my patients to do cardiac rehab. We've spent most of the time today talking about those risk factors and how to manage those. I think that's the big thing that we can do to reduce your risk. And then get support. You know, having a heart attack is a big deal. A lot of times folks will be dealing with some stress and anxiety about that, maybe some depression, depressed mood. Just make sure you have the right support around both your family and your friends and your doctor to help you through that time afterwards. So that's all I wanted to share with you guys today. I wanted to leave plenty of time to talk about questions you guys had, and thank you for having me today. I appreciate it. Ma'am.
You're talking about the rehab. Where is the closest one around here? See?
Right here.
Downstairs, across from Fleetwood.
Yep, so we have our own cardiac rehab here at Baptist Easley. My patients have all had great experience here. The biggest one is in Greenville at the Life Center, right across from the hospital. That's kind of where we're all based out of. But Easley has their own site. Oconee has their own cardiac rehab there at Oconee Hospital. And there are also programs in Greer, and I'm not sure about Hillcrest. But
Well, I used to go to the YMCA, and they had what they called silver seekers, and this was listed as part of it. Now YMCA says we don't need that anymore.
I see. So cardiac rehab is sort of a specialized program, and in general, insurance, Medicare will pay for it after very specific things. Heart attack is one, heart failure is another. But there are kind of rules about who can enroll and who they don't cover for that. I think one of the big benefits of cardiac rehab is that it just shows you what to do, shows you how to exercise and the things you should be doing and how to do it safely. And it's really meant as a way to get you moving and keep you moving. So I always encourage my patients, you've got the tools, now go do it. Make it part of your lifestyle. Sir?
I was very fortunate. My stepfather said when I was 16, if I didn't smoke till I was 21, he'd give me $100. Well, in that era, $100 was a lot of money.
He's a smart man.
He never made good on it, but I'm forever grateful.
You stopped.
But, no, I never smoked. But a friend of mine who was a heavy smoker recently got onto the e-cigarettes, and he said that he started weaning himself off on the amount of nicotine per whatever that goes into those units, and now he's at the point where he still occasionally does the vaping, but he's getting no nicotine. Now, is he fooling himself?
So that's a good question. So the question was about these new e-cigarettes and the fact that you can use them without nicotine. I think there's one big caveat that these things are so new that we haven't really fully studied them, and we don't know the long-term problems that people are going to run into. I think that they are probably better for you than smoking cigarettes. They're definitely a good thing if you use them to help you quit, and that, as you described, the kind of weaning down of the amount of nicotine in your solution or whatever is a good way, I think, to help quit. But I've got to imagine that inhaling whatever these chemicals are over a long term is probably not good for your lungs. I think they can be a helpful tool if you use them to help you quit smoking. But I always encourage people, the ultimate goal is to set it down, to not use anything like that at all. We have other medications that we can use to help decrease your cravings for cigarettes that are also effective as well. Man.
Just a clarification. Did you say the goal for blood pressure was 120/80 and that you start treatment at 120/85?
Yes, ma'am. That's right. So ideal blood pressure is 120/80. If you crept up in that in that area between 120 and 130, we will typically talk to you about lifestyle changes, salt restriction, exercise, all those things. And these days, the current guidelines suggest if you're above 130 or above 85, that's when we talk about treatment. And I usually will give folks who are above that number, as long as they are not severely above that number, a chance to change their lifestyle. And a lot of them are able to drop that back into healthy levels just through some of those lifestyle changes. But the goal is 130/85 currently.
Dr. McNeely, these low-carb diets have become really popular in recent years. What would you say to someone that was doing a low-carb diet like the keto diet?
Okay, sure. So low-carb diet. I think reducing carbohydrates is a good thing. Not only does decreasing carbs, especially simple carbohydrates, reduce your risk for diabetes, probably also benefits your cholesterol as well, because carbs are sugar basically, and when your body gets a big load of sugar, it changes that into triglycerides, and triglycerides are the building blocks for cholesterol. That's not a good thing. So I think low carbohydrate is a good thing, but the question is, what are you substituting for your carbohydrates? Now, some of these keto diets just recommend you eat nothing but steak all the time, and or bacon, right? And that may be a good thing for losing weight, or maybe diabetes, I doubt it, but it's certainly not good for your heart long term. Now, I think if you reduce your carbohydrate intake and replace that with vegetables, plants, high fiber plants especially, then that's unquestionably a good thing. But the question is, what are you substituting?
Just a clarification.
Sure.
What you just said. You said triglycerides are the building blocks for cholesterol.
One of them. Yeah.
One of them, okay. Can you basically manage your triglycerides just by what you eat?
So most people, the question was, can we manage our triglycerides by just what we eat? And the answer is that for most people, the main determinant of what your triglyceride level is diet. Carbohydrates, saturated fats all go into that. There are some people who have inherited defects in how they process cholesterol, or triglycerides especially, and those are very elevated kind of no matter what. And those people are the ones that are going to benefit from treatment and can make changes in their diet and beneficial effects, but may not ever get to normal. But it is that of all the cholesterol numbers, triglycerides and LDL, the bad cholesterol, are the two that change the most with diet changes. HDL, the good cholesterol, is one of those things that's more determined by your genetics, and you can make small changes, but it's hard to make big swings in that number. Yes, ma'am.
If you have a lot of those symptoms that women can have, but all your heart tests have been negative, what could be going on?
What could be going on? That's a great question. So I think that the list of symptoms for heart attack there are a lot of things on that list that there's a whole lot of other stuff that can cause that. Sure, back pain can be a sign of a heart attack, but back pain is very, very common and has a lot of other causes too. Nausea and vomiting, same story. That in the right situation can be a sign of a heart attack, but can be from a lot of other causes: gallbladder disease, ulcers, a whole lot of other things. And I think that's where your cardiologist and your other doctors come in, is trying to tease out whether these are symptoms of heart disease or something else. We have a lot of good ways to assess that risk through stress testing and that sort of thing. That's pretty highly sensitive, and it's not impossible, but it's rare that we miss significant disease through our testing these days. And I will say, you've got to balance how suspicious your symptoms are with your risk of disease. If you have really highly suspicious symptoms and a high risk of disease, sometimes a negative stress test doesn't really make me that reassured. And sometimes we think about doing an invasive test like a heart catheterization, even when they're normal. But for folks with just intermediate risk factors or intermediate sort of symptoms, I think that's a great way to reassure your doctor and you that it's not your heart. Ma'am.
What does a high heart rate, a pulse rate, what effect does that have on the heart?
Question is, what is a high heart rate or pulse rate? What effect does it have on your heart? I would say it kind of depends on how high. So severely high heart rates for long periods of time can weaken the heart muscle and just cause it to get tired and not beat effectively. And we call that heart failure, tachycardia-mediated heart failure, or high heart rate related heart failure. But in general, if your heart rate is just a little bit high, just above what we consider normal, that's not typically a dangerous thing from a heart standpoint. And as long as the heart rhythm is normal, it's almost always a symptom of a healthy heart that's responding appropriately to something else, whether that be infection or dehydration or something like that. So it's kind of a sliding scale. I would say a mildly elevated heart rate doesn't really pose a whole lot of long-term danger for your heart. Significantly elevated is something that we would want to look at.
When you say elevated, how elevated?
Yeah, so we think normal heart rate is anywhere between 50 to 100. If you're slightly above that in the 100s, 1-teens, that's something that we typically, as long as your heart muscle is squeezing normally and functioning normally, that we don't worry too much about. Oh, got one more.
What are the dangers from a low heart rate or low pulse?
Sure. It's rare for patients to have a normal heart rhythm without any block and have symptoms from low heart rate. That's rare. Our bodies are just, in general, pretty good about maintaining that, maintaining your blood pressure, even if your heart rate's on the low side. If your rhythm's normal, probably nothing to worry about. If you have heart block, which is something that happens when the electrical wiring in your heart sometimes gets little short circuits in it, that can cause symptoms. The most common symptoms of too low of a heart rate would be dizziness, lightheadedness either when you stand up and change positions or when you're exerting yourself. Certainly passing out for unclear reasons with not really much warning. Those would be things that we would worry about. Profound fatigue can also happen if your heart rhythm is abnormal and your heart rate is much too slow. So those are the common signs.
What about when you have a low pulse, not pulse, heart, blood pressure, when your blood pressure is on the bottom side is low, rather than high, you know,
Uh-huh.
below 80, back in
Sure.
the 60s and so on.
Yeah, in general, as long as you're feeling well and you're not having signs or symptoms of low blood pressure, a low diastolic pressure, that bottom number below 80, we don't worry too much about. Sometimes as folks age, as folks age, their blood vessels get a little bit less elastic, and so in general, as you get older, those two numbers tend to kind of creep apart a little bit, and that's in part because of those blood vessels just can't bounce like they used to, and so you get a little bit higher on the top, a little lower on the bottom. And sometimes it's finding if you're being treated for high blood pressure, it's finding some compromise that lowers that top number enough that we feel good about reducing your risk, but not driving that bottom number so low that we cause symptoms, dizziness, lightheadedness, that sort of thing.